Well, for more now, I'm joined by Dr. John Campbell. He is a health analyst based in England, and he is considered an authority on all questions about this pandemic. It's good to see you again. What is it about this Delta variant that means so many countries are now increasing pandemic restrictions where they were just emerging back into normality?
It is just so disappointing, Brent, isn't it? Things were looking like they were going well, and now we're sort of plunged back into the depth of it. It's the increased transmissibility of this variant. Now, Public Health England have said it's 64% more transmissible than the previous UK Kent Alpha variant, and that was about 40% more transmissible than the original wild strain variant. So this is at least twice as transmissible as the original variant that we were dealing with. And this means that measures that were working before, such as household isolation, for example, are no longer working now. We're finding that the virus is spreading around the whole household. This is largely how it got seeded in the UK. People coming from India, they were isolating at home, but passing the virus on to other members of the household who were taking out into the community. And things in the UK, the cases are going dramatically up. I mean, today in the UK, almost 23,000 new cases in the UK just of the single day, and up about 70% on the past week. There's a really sharp increase in places that have this Delta variant. The percentage of cases seem to be pretty well doubling every week. So somewhere like Germany now at about 15%, next week could well be 30%. Very transmissible, high viral loads, smaller numbers of viruses need to become infected. It's a big transmission problem.
And what about the vaccines? Is there now a consensus on which vaccines are or are not effective or can protect us against this Delta variant?
The big thing about the Delta variant is you don't get a high degree of protection after one dose of either vaccine. So we're looking at about 30% for the Oxford AstraZeneca vaccine cover for the first dose, only about 36% for the Pfizer vaccine. But after two doses, the effects are really quite similar. And the protect against hospitalization and sickness, which is really the important thing, are about 92 and 94% protection. So even though there's slight differences in the risk of getting symptomatic disease, the chances of getting really sick are very good. We've got good levels of protection with both vaccines, whether it's the Oxford or the Pfizer vaccine that we're using in the UK. Interesting point, though, that the symptoms are changing quite a bit in people that are vaccinated. So people need to have a high index of suspicion for common cold type symptoms. So the most common symptoms now in people that have had two vaccines are headache, runny nose, sneezing and sore throat. So if people are getting those, they need to consider the possibility of the virus, go and get tested in case they're passing it on to more vulnerable people.
And, you know, we are beginning this height of the summer travel season. Some countries have reopened to tourists under certain conditions. And we know that thousands of people are traveling to the Euro 2020 football venues. Is another spike in cases inevitable with this?
The Euro 2020 is a concern. The epidemiologists in Denmark have identified 5 cases of Delta variant in Danish fans, and they're pretty sure they got it from a football match. That means they got it outside, even though the crowds are not at capacity. Now, that transmission outdoors would not have occurred with the original variant because this is so much more transmissible. It is possible that the Euro football tournament could be a super spreader event. We hope not, because it is outdoors, but there are cases and evidence of that now. And I really think we are taking, with what we know today, we're taking quite a risk on carrying on with these large capacity football games.
Well, when you look around the world, Dr. Campbell, the places where the Delta variant is really spreading almost out of control, are there enough vaccines there for people to get vaccinated?
Absolutely not, Brent. I mean, we're actually looking at a tale of two worlds now. We've got Europe, the vaccination programme is going really well. It's catching up with the UK. It's actually accelerating. The UK is reasonably good. The United States is kind of in between the two of us. The vaccine uptake in the US has been slightly lower of late. Vaccines are going well in China, but pretty well everywhere in the world, vaccinations are low. In Russia, it's due to low uptake, but in most countries in the world, it's due to low vaccine supply. supply. And we know that because this variant is so much more transmissible, we need a higher level of community or herd immunity to suppress the virus. We're probably looking about 80% of people that we need to be immune to really suppress this virus. And we're nowhere near that in Indonesia, for example. Cases are spiking. We've learned about Australia, South Africa with the Delta variant. Countries I'm particularly worried about: Bangladesh, Pakistan, Myanmar, Thailand, Cambodia, Vietnam. All that area are seeing dramatic increases now with completely inadequate vaccination. We really need to have an emergency sort of Manhattan Project on vaccines for the world.
Dr. John Campbell, it's always good talking with you, Dr. Campbell. We appreciate your time and your valuable insights tonight. Thank you.
Thank you, Brent.